Unseen, this is the reality of people suffering from comorbidities in rural areas, hidden in hindsight, forgotten, left without light. For them, the greatest pain is not always felt in the body, but in being left alone. Like Aling Rosa, an elderly woman living with rheumatoid arthritis that has twisted her joints, gout that worsens her suffering, and hypertension that weighs on her daily life.
Problema ako sa ganitong kalagayan ko.
That is when community-based health workers step in, including volunteers, rural midwives, nutritionists, and public health nurses. And yes, I am one of them.
Good morning, Nay! Nurse Alia po, at your service.
But we are not standing alone. We are part of a bigger model of healthcare delivery called the community-based health system. This system includes service delivery, health information systems, medical products and vaccines with technologies, financing, and strong leadership and governance. All of these components work together to make healthcare accessible, equitable, and responsive even in the most remote areas. Despite this, the World Health Organization reports that only about 14% of people who need palliative care globally actually receive it. And here, many elderly like Aling Rosa are still out of reach.
As a nurse in the barrio, I see, hear, and feel the struggles of people needing palliative care.
Palliative care is a specialized approach that assists patients with multiple coexisting illnesses by addressing their physical symptoms, emotional needs, and overall well-being, with the goal of ensuring comfort, dignity, and a meaningful quality of life. But how do we do this?
The World Health Organization guidance and evidence suggest that effective community health system begins with an assessment where we understand the health needs of the community. Next is planning, where we set priorities and strategies with the resources available. Then comes service delivery, providing essential care such as checkups, vaccinations, chronic disease management, and palliative support. Community-based health system is then strengthened by support systems, enhanced through training, and sustained by community empowerment. And finally, there is evaluation, where we monitor results, learn from feedback, and improve services for the future.
In our barrios, palliative care is more than medicine. It is presence, compassion, and community. Thus, the role of a community-based health system.
Through regular home visits, health workers identify patients like Aling Rosa early, patients who carry the heavy burden of multiple illnesses. CBHs make sure they are never left unseen. Community-based health system provides relief where families need it most, at home. With proper training, health workers manage pain, distribute medicines, and teach families how to provide day-to-day comfort. The World Health Organization emphasizes that training is the backbone of palliative care. Here, barangay health workers and volunteers are empowered with skills to recognize suffering, provide care, and support families in the hardest times. A strong community-based health system secures access to what patients with comorbidities need most: timely medicines, coordinated referrals, and financial support. Because without these, managing one illness is hard enough, but managing several at once becomes impossible. Palliative care is not only clinical, it is cultural and communal. By empowering families and involving community leaders, CBHS ensures care reflects the values of dignity, faith, and bayanihan that define us. Finally, community-based health system provides holistic support, physical, emotional, and spiritual. Because in our country, caring for the sick means caring for the family, the soul, and the community. The role of community-based health systems in palliative care is clear. It reaches the unseen, uplifts the suffering, and strengthens the bond between health workers and the community. For patients like Aling Rosa, it restores not only health, but dignity and hope.
Together, let us strengthen our community-based health systems so that no individuals, especially elders, no matter how far, faces pain and illness alone.
Sa iyong mata, di ko